All right, our next talk is going to be on opportunities in teaching and educational administration, and we're very, very pleased to have Dr. Talia Spector as our presenter. Dr. Spector is a board-certified internist and emergency medicine physician and a full professor of medicine at the David Geffen School of Medicine at UCLA. She is a physician educator and an author whose expertise includes curriculum design, teaching, and remediation of clinical skills and coaching. Dr. Spector is also a SEEK alumna. She has designed and implemented in-person and online curricula for the David Geffen School of Medicine, the National Cancer Institute, the National Human Genome Research Institute, and the National Violence Prevention Center, and has written examination content for the National Board of Medical Examiners. She has written a book chapter on remediation of physical examination skills and is in the process of publishing a two-book series for medical students entitled Strategies for Success in Medical School and Beyond. At UCLA, Dr. Spector teaches first-year medical students in the Foundation of Practice course as one of 40 educators for excellence. In that capacity, she teaches clinical skills and serves as a life and career coach. She is also the program director for the inaugural third-year longitudinal clinical experience, it's a tongue twister for a lawyer, during which students hone their clinical skills and is a lead in remediating medical students who failed their clinical performance exams. After struggling with a devastating and clinical career-ending injury, Dr. Spector no longer provides direct patient care nor supervises residents in the emergency department. Besides teaching and administration, she also has both personal and professional experience with vaccine injuries, performing medical chart reviews, and writing medical expert reports for patients in litigation with the Department of Health and Human Services Vaccine Injury Compensation Program. Dr. Spector received her BA at Vassar, her post-baccalaureate pre-med at UCLA, and her medical degree at UCLA as well. She also has a diploma from the Tropical Medicine Gorgas Memorial Institute, and she was a fellow at UCLA, Harvard, UCLA. So I butchered a lot of that, Talia, but I'll make you pronounce some legal terms sometime. Welcome, Dr. Spector. Welcome back. Thanks for coming.
Thank you so much. Thank you for having me. I'm excited to be here and hopefully be able to impart some wisdom that can be helpful to some of the individuals out there who might be interested in looking for other opportunities. So a little bit about me. You actually, Jim already kind of said a lot, but as a professor of medicine at UCLA, I work with each of the 3 first years of medical schools students as an educator for excellence, where I do clinical skills, teach clinical skills, doctoring, how to take history, do a physical exam, clinical skills, etc., clinical decision-making. And then we do some life and career coaching. In the second year, which is the clerkship year now at UCLA, the students take an 8-patient OSCE, which is the clinical performance exam, and those students who don't pass get to meet with me and 2 other people. So we work with the students individually after that experience. And then I am the program director for this longitudinal clinical experience, which is a mentoring opportunity for students to go into the field and work with clinicians at their sites. So I will talk a little bit more about that in terms of opportunities for everyone. As Jim said, I'm an author. I actually started by writing a lot of clinical scenarios for standardized patients. And that led me also to get involved in writing test questions for the National Board of Medical Examiners, the book chapter, and then this book. I've designed careers, as you mentioned, online and in person. A lot of fun doing that. That began with some grants. And then I became a medical legal consultant mostly because I had to be an advocate for myself after an injury. And no offense to lawyers, but they're very busy, and I knew my case better than anybody else. So I took on the lead and luckily was successful in my litigation. And I'm married and a mother of 2 teenage boys, which is probably what keeps me on the toes more than any other job that I have. So just a little bit about me. I graduated high school in 1988. And from that, I went on to college and worked in international public health after college. So that was my career. In my college degree was in international public health. And then I decided that I really didn't enjoy the bureaucracy of working in international um, bureaucracy, basically the bureaucracy of trying to get things done at a political level. And so I went back and did post-bac pre-med classes and medical school and ultimately a residency in both internal and emergency medicine. So that was my first career change. That one was by choice. In 2005 to 2007, I did a fellowship, and this is when I did a lot of clinical work. Absolutely loved being a doctor. I was an ER attending physician at a couple of two different county hospitals. I also worked at Kaiser, and I taught the medical students and the residents who rotated through, and really, really enjoyed being a doctor. In 2013, I went for my mandatory flu vaccine, and it was administered incorrectly. It was too high and went into my infraspinatus tendon. And I developed a series of pretty devastating complications, a tendinitis, tendinopathy, shoulder impingement, and then ultimately thoracic outlet syndrome. I probably should have stopped working, but who stops working from a flu shot? So I kept going until about 2014 when I was unable to perform clinical duties. I had numbness and tingling and a loss of dexterity in my hand. So I was not able to engage in many of the procedures that were required in emergency medicine. Plus I can't lift patients, which made it difficult to examine patients. Anyhow, I was very devastating. I had a lot of depression and was even diagnosed with PTSD at the time, and was very lost. And I did attend the SEEK conference in 2017 where I was inspired. I really was inspired by a lot of the other physicians who I met, but also just sort of given a direction. I felt like I had no direction at the time. So at that time, there was a pre-conference. I don't know if there still is, but there was a pre-conference about writing, and I was advised to write a book. And so that night, I went back to my room and came up with some chapters. It's obviously changed since then, but I'm very excited to say that I have finished writing 2 books. The first book is under peer review right now, and I am doing the final editing of the second book. So it is a slow trajectory, kind of waylaid a little bit by COVID and having to homeschool my kids, et cetera. But I am still pushing forward with that. So I'm excited. And so the second career change was not by choice. It was by necessity. But I'm excited to share that I am now an educator and administrator and really enjoy it. So I'll talk a little bit about both of those and just kind of the individual steps that I went to in each of those areas, because you don't have to do both, but I just happen to. So in terms of being an educator, I did the IM/EM residency and the fellowship. So that was my formal education. And like I said, I was a clinical attending from 2005 till 2014. I switched from the emergency department to urgent care after my injury, and then ended up not being able to even work there. I will say that I volunteered in a lot of medical school courses. I really enjoyed teaching. This was during that time as well as afterwards. And from that, I was invited, because the person before me moved careers or moved locations, to participate in some remediation. And eventually I became the go-to person at UCLA for remediation for students who are struggling doing faculty development. I was invited to write a book chapter on remediation of physical exam skills. Was not super excited about writing a book, gotta be honest, or a book chapter. It was, but I kind of thought that it was an important thing to do. And so I'm actually very excited that I did it, because I got to work with another colleague who's now at USC, who I still keep in touch with. So it was a really good experience. And then from all of that teaching, when the program changed 5 years ago now at UCLA, And it was one of few programs that actually pay educators. We're one of 40 educators teaching in the first year curriculum. And actually it's wonderful because I have my students in the first year, but then get to keep involved with them for the subsequent couple of years, mainly doing coaching and life coaching and career clinical coaching, et cetera. In terms of my administrator hat, I started in my fellowship participating in a bunch of educational grants, which we mentioned. These were national grants that my mentor was a principal investigator on these. And from that, I also did some curricular design and again, volunteered in medical school courses where I was tapped into being the chair of the third year preceptor program. So at that time, that program was, the clerkships were in the third year, and this was one of the required clerkships. Again, working with individuals in the community. As the chair of a clerkship, I was invited to be on different committees, the clerkship chairs committee, promotions committee, got very active, involved in medical education from an administrative perspective. So much so that now I'm on the medical education committee, which is exciting. And then from when they shut down the third year preceptorship program because we changed curriculum to the HEALS curriculum, I became the inaugural director of the longitudinal clinical experience, which is a very exciting program where I have students analyze their current clinical skills, compare it to what their aspirational skills are, develop goals and action plans, and then do some deliberate practice with faculty in the community. So it's a great program, and it has helped me get other faculty involved and excited about teaching. So there are other paths. You don't have to, follow my path to be an educator. There are other educators for excellence in the program who did a residency, and they were either a preceptor, had students coming to their site, or they were an attending. So in the residency program, usually this was the most common pathway, or they were a facilitator in a clinical course that was a non-medical course, or non-clinical rather course. And then eventually they were tapped also into or applied for this Educators for Excellence position, which is paid. Not paid a lot, but it's paid. And then in terms of being an administrator, you can go from residency. Usually that if you work in a clinic or a hospital, you get to be part of a committee. Wherever your niche is, you gain experience within that niche, and then you become the director of whatever it is that is in your niche. And then from that, you can move on to be a medical director, or in the academic sphere, a dean. So there are a lot of benefits to being an educator. First and foremost, you get to pay it forward to students and the medical profession. You're really enhancing the clinical skills of your future colleagues. That was my selling point to the faculty that I was trying to get involved. Like, who do you want to work with? Like, here's your opportunity to mold the person that you are going to consult or ask to be to consult on your patient. And I think that's really exciting. It also really keeps you on your toes, right? I mean, students ask very insightful questions. They've done some research or are learning about topics that have changed and evolved because of just time and new science, et cetera, advancements, scientific advancements, technological advancements, and they keep you on your toes with the questions that they ask. So that's a lot of fun. And there is prestige involved to having an academic title. I will say that when I applied or contacted a publishing company, the fact that I have an academic title made it that much more interesting to them to want to publish my book. And overall, it's very rewarding and a lot of fun. There are a few drawbacks, being really honest. So it doesn't pay as well as the private sector in general. It does, however, especially in county hospitals, does offer great health and retirement benefits. So there are clinical teaching. If you have depending on how you're paid and your productivity, taking time to speak to students and listen to their oral presentations or review their documentation or whatever it is can hamper some clinical productivity. So if you're really focused on SVUs and stuff like that, just be aware of that. There is a lot of fun in classroom teaching, but for example, as an educator for excellence, I get paid for the 4 hours that I'm teaching, but there's prep work that I have to do, and then I assess some of the student, oral presentations, or I give feedback, a lot of feedback, and that can be fairly time consuming. So you need to build that time into what you're doing. And unfortunately, there are very few full-time or even paid positions in education. I don't really understand why. For medical school, teaching is an expectation or of academic advancement. You're expected to have a productive clinical work. That's not the same expectation in law school. You're not expected to be have a certain number of billable hours and, oh, by the way, teach, or in business school, but that is the case in medical school. Hopefully it's changing across the nation, but it was exciting for UCLA to have that change a few years back. Benefits to being an administrator sometimes can be very well compensated, depending obviously on your role. You have an opportunity as an administrator to make some really substantive changes. So there are times, we look around at what's going on and we are dissatisfied with the operations or the practice or the quality of care, clerkship, et cetera. And being an administrator, you become, in a position where you can make some changes to that. So that can be exciting. I took that as an opportunity. I thought that we needed to get a little bit more clinical coaching for the students kind of throughout the years. And so as part of my longitudinal clinical experience, I was like, well, we really need to prepare for that by instituting these changes in how we give feedback for the, clinical performance exam, or how we are giving during intersessions. So even my role in my kind of realm, I was able to tap into and make some suggestions and changes in other parts of the curriculum, which is exciting. Also, as an administrator, sometimes you can replace some of your clinical duties and responsibilities with non-clinical ones. So if one of the issues is a little bit of burnout and you're working too many shifts, et cetera, this is an opportunity to match your salary, but just replace some of the clinical duties. And there are a lot of different opportunities in administration. So, and of course, it can be prestigious as well. So drawbacks to being an administrator, it can be really high stress, a high stress environment. I have a colleague who was the medical director of the emergency department during COVID, and she was responsible for finding PPE. I can't even imagine what a nightmare that must have been for her, but it was super stressful. And, the buck stops to you: staffing issues, mistreatment, mandated reporter, discontented individuals, whatever it is. It can be stressful. Sometimes it can put you at odds with colleagues, although I think it really depends on how you integrate and accept feedback, and how willing you are to have folks participate in making changes. So as an overview of different teaching and administrative opportunities, the obvious one that we think about is in medical schools, right? There's teaching and administration involved, but maybe you don't live near any medical school. So there are other opportunities available in allied health schools. So paramedic, EMT, PA, NP, remediation, these are all schools that might be closer and have opportunities available for teaching with or without clinical duties. Clinical duties with the allied health schools, I looked into this, really they're looking for opportunities for the PA, NP, et cetera, to go into the field, so that you would serve as a preceptor. But sometimes these are paid positions. So just something to think about. And then obviously within a hospital or clinic setting, there are teaching opportunities, a lot of teaching opportunities for patients. And all of you have experience because we all teach our patients, about their health, about, how to manage their care, et cetera. But there's also sometimes opportunities for developing CME, working with staff and other faculty, et cetera. So that those are opportunities within clinics and hospitals. And then there's always some administrative opportunities as well. So really, when you're thinking about education and administration, you want to think about what your goal is, right? If your goal is to like, you're happy with what you're doing and you want to stay doing your clinical work, there are opportunities for that. And that really maybe you're just burned out and you want to improve your job satisfaction or have a new role, et cetera. So that's one spectrum, and this is really a spectrum. And then the other side is, supplemental replacement income, right? You need out, right? So how can you replace your income? I will tell you that it would be very difficult to replace all of your income in administration, in academic administration. So let's talk a little bit about improved job satisfaction and the new role. So this is usually part-time, and it might not increase your income substantially, but it would definitely infuse some energy and life into what you're currently doing. So there are clinical teaching while you're engaged in patient care at your home setting. There are other teaching opportunities that are non-clinical, and then there's administrative roles. So I'm going to kind of go through each of these. So in terms of clinical practice, you can precept in your own setting. So students will come to your setting from either an allied health or medical school, and they see your patients, sometimes without you, sometimes it's a shadowing, it depends on what year in the curriculum they are. And then you observe them if you can directly, or you will hear about oral presentations, talk about documentation, talk about medical, clinical decision-making, et cetera. The other opportunities are that sometimes, let's say, they have a clinic that needs to be staffed at the medical school as part of a clerkship. So for example, in internal medicine, we had a dermatology clinic that needed staffing from dermatologists. And so the dermatologists would come in, staff the clinic with the medical students and residents and other attendings. And so depending on what your field of interest is or your specialty is, those are other opportunities at training at specific training sites. And that is frequently done in medical school. I believe it's also available in allied health schools. These are sometimes can be paid, sometimes they are, and sometimes they're not. But it definitely can bring some prestige to your clinic as well. So as I was kind of updating my slides last week, I received an email from one of my preceptors who's amazing, and I got him involved. He was really burned out, and I got him involved in teaching again. So I'm just going to read this to you with the enthusiasm that I know that he wrote it with. Teaching EM is by far the best thing that has ever happened in my career, re-inspiring me and allowing me to cherish and delight in the enthusiasm and excitement of the myriad learners I've been privileged enough to engage with. I'm so blessed. So I'm so blessed to have faculty like that who are enthusiastic and interested in teaching my students. But so it is definitely a synergistic relationship. Anyway, I just was so perfect, I had to add it to my slides. So non-clinical opportunities, these are also available in medical and allied schools. So for example, teaching physical exam skills, teaching point of care ultrasound skills, sometimes doing a case review. We have ophthalmologists that come in to help out at UCLA in this Foundations of Practice course, because I mean, I'm not an expert. I have some expertise, but we have faculty from all different lines of work. And so the ophthalmologists come in and help out and go over cases on one of the days. It's like a twice a year commitment, I think. They can also get involved in programs like doctoring, which is how to speak to patients, et cetera. You can be a content expert, right? So my kiddo is in high school, and he has a kinesiology, he's a sports medicine kinesiology course at his school. And so they had an orthopedic surgeon come in and speak about, how to kind of the process involved in after they do their initial intake and wrapping, et cetera, like what's the progress that a patient would go through so that you can kind of understand the full picture of from the injury to healing, all the parts in between. So that's exciting. And then again, you can be a content expert for medical schools, for residency programs, depending on what your interest is. We had a dermatologist that come and speak about dermatologic manifestations of systemic illness in the medical school. I'm sorry, in the emergency department. And so like, oh, when you see this, whatever this rash is, what should that alert you to? So just kind of exciting to be a content expert in that way. You can also create educational content for patients, staff, colleagues. I think I mentioned this in terms of CME. And then there is growing opportunities available in physician remediation. The National Board of Medical Colleges sometimes has programs, and but there's sometimes private remediation schools across the nation. So that's another area where you can potentially teach in a non-clinical setting, but clinical content. So administrative roles. So eventually, in terms, if you develop a little bit of an expertise or an interest, you can be the director or the chair of some sort of program. So it could be the standardized patient program, simulation, assessment, clinical advising, POCUS, preceptorship, whatever it is. And then when you become the director of that program, then you can become the director that oversees multiple programs. And then eventually that can lead to a dean position. You could be a program director. I am the program director for the longitudinal clinical experience, but we have 5 affiliate sites with UCLA, and each one of those I tapped in and found somebody to be a site director, so that if there are any problems with the students or the student faculty pairings at the site, that site director is responsible for making sure that everything is running smoothly at that site. So it's a paid position, not paid very well, but it's a paid position. So being a clerkship director of education within a clerkship, this is usually for people already involved in teaching at the medical school, but you can get more involved. And then, like I mentioned, some dean positions. So the way these academic and teaching roles are compensated can be a little bit complicated. So oftentimes you'll get a stipend. It's just like, okay, here's $10,000 to do whatever this role is. Or they might buy time from the clinical duties. So for example, my mentor, when I did my fellowship, I worked 2 night shifts for her, and that was how she got paid by the hospital to get involved in this fellowship program. I think she actually arranged that because I think I was her first fellow, which is pretty clever. But anyway, she got to buy out some of her time and some of her clinical duties. You should know that often with these in academia, the administrative and teaching compensation, this is a part-time gig, and so you'll still be required to do clinical duties. I have an exception, I guess, if you want to call it that, because I have an accommodation for not being able to do clinical duties. And then you should know that many institutions require disclosure of outside employment. So when I worked at Kaiser, for example, I was a per diem physician there, but some of my colleagues who were full-time had to use their ed time to go and teach for whatever reason, and they couldn't get paid for it. So they had to disclose that. So you might need to look into your current employment and see whether they allow outside employment, in which case it might not be worth getting paid if the money doesn't end up going to you. And then you have more opportunities available potentially for unpaid options. So also sometimes the pay increases over time, right? So in academia, right, you're a clinical educator, then you become an assistant professor, associate professor, and then a full professor. And with each one of those academic titles, your pay can increase. Also, depending on what your specialty is and if it's in demand, you may be able to negotiate a salary that's comparable in some way to the private sector. So just keep that in mind to know what you're worth. If you're looking for a job and that is a paying job, you might want to, you need to understand how sometimes the pay is done. So the unit of workload measurement in a lot of these institutions are as a full-time equivalent or an FTE. And so the job might say that this is a position that is a 0.2 FTE. So that means about 20% time of what your full-time salary would be if you were employed full-time at that rank, step, title, etc. So that's one way is as with FTE. And the other way is percent effort. This percent effort might be based on your academic title and step. So it's specialty based. So ophthalmologists make more than pediatricians. It's not fair, but it's true. And so depending on what your step, rank, title, etc. is, that could be a percent effort of that time or of that salary rather. Or they might use the NIH salary cap. So every year the NIH has a salary cap. This 2025 was about $222,000. And so if I am a 20% effort, then it's 20% of that NIH salary cap. And then every year that salary cap goes up. So you get the rate of increase based on whatever the national rate is. And that is one way to keep things standardized. So initially, when we were E4E, we were paid based on the academic title and step. And I will pat myself on the back because I kind of argued when that it was unfair if we're all doing the same teaching, that just because you're an ophthalmologist, you shouldn't get paid more than a pediatrician for the exact same work. So that's why they actually switched to an NIH salary cap. So go me. You're welcome to all my colleagues who are pediatricians. So salary ranges. So this is from salary.com. So there's a wide range of salaries depending on what your positions are in administration and teaching. Obviously, I mentioned that it's by step, but it also depends on the city where you work. So for example, LA is the cost basis of living is so high. It might be higher than, let's say, in Bakersfield or something like that. But on the flip side, if you are the only doctor of your field in Iowa, then you might also be able to garner a higher wage because they need you there, right? So depending on where you are and your field and your education, and of course your experience level, the years of training or years of experience. So anyway, here are different salary ranges for the different positions from the directors and residency program directors, etc. So back to this question of your goal, kind of looking more at how to supplement your income, let's looking at some opportunities in that area. So there are hospital and clinic teaching and administration, supervisory roles and teaching. So I know that Jim has somebody else coming in to talk about, or has another lecture probably on hospital and medical administration. So I'm not gonna talk about that, but just to mention that hospital or clinic director is obviously a great administrative role that is fairly well paying usually. You can also become a department director. So the department, if your department is radiology or ICU or hemonc or whatever it is, you might be able to be a director within your department, and that can be an administrative role. And then kind of thinking outside of the box, you know, being a medical director is required in a lot of clinical settings, right? Skilled nursing facilities, telehealth companies, dialysis centers, urgent cares. These are all places where if you can become a medical director potentially apart from your regular job, and that can supplement your income. And sometimes those roles are apart from the pay that you get for clinical work. There are also opportunities when I was looking around for things. I was going to a chiropractor and he asked me if I wanted to get involved in basically putting my license, right, to being a licensed physician as part of that center, as part of his offices, where they could then prescribe, they could do injections, right, ketamine infusions or Botox or whatever it was that they wanted to do. But basically any procedure that requires a medical license. So this is another opportunity. I will say that I personally was not comfortable with that, but I'm just letting you know about it. So you have to be comfortable supervising from afar, right? So you will sometimes be just given a bunch of charts to review at the end of the week of these are the patients that we saw, sign off on them, et cetera. That again, I'm maybe not comfortable. I was not comfortable with that. And then make sure that you ask about liability, your insurances, malpractice insurances, what kind of contract the liability is. So just trying to give you as much information as possible, but I don't have personal experience with that. I think I mentioned that teaching for the allied schools, so EMT, paramedic schools, nurse practitioner. The other thing are pre-health schools, right? So there are programs that are pre-med, like pre-med schools in university and community colleges that might be a great place to lecture. Sometimes it's paid, sometimes it's not, but it's kind of fun. So here are some administrative salary ranges from salary.com and indeed.com. And again, very large range. Okay, so let's say you want to get involved in academics. So how do you get involved? So I would say volunteer. It's fun, right? I have a teen child, and he was looking for a job, summer job, and he asked, when he was applying, he's like, well, how am I supposed to get a job? Everywhere I look requires experience. How do I get experience if I've never had experience? So same thing with academia, volunteer. People are very happy to have you volunteer, and that's how you get experience. Say yes. I mean, I said yes to a lot of opportunities, writing a book chapter that I had no interest in doing, getting involved in remediation, and yet that has launched other parts of my career. So, say yes to different opportunities to share your knowledge and build your skills and maybe assess competence, etc. Become a subject matter expert, write a book chapter. That's thanks to you, Jim. There it is. Join your hospital's education committee. There are, you can get involved in CME and patient education, and then you get experience through that committee work. Plus it's great networking for people who are already involved. Once you're in a committee, if the senior person retires or leaves, then now you're in a position to assume a larger role because you have experience in that. You can contact your medical school or an allied health school about preceptoring or lecturing, helping with skills training. Again, you can start this as a volunteer potentially, and then if after you have some experience, you can start negotiating for a salary. You can consider getting a teaching fellowship or an advanced degree. I don't know that it's necessary, but I thought it was helpful for me. I would say first and foremost, find a niche, right? Whatever your niche is, it can be what your passion is. And your passion, it could be because you're really interested and like it, or it could be a passion because you find a need that you're frustrated by the fact that things are not done well. Maybe people are burned out. They're not putting as much effort into making changes that need to happen. That can be a passion that you really want to make a substantive change. Another question is, what are you good at, right? There are, it'd be ideal if those two, what your passion was and what you were good at, aligned. Doesn't always work that way. I happen to be good at math, and I'm very detail oriented, and yet I would not want to be a forensic accountant. Just wouldn't work for me. So what are you good at? What's your passion? And the other really big question is, where's the need? So if you can figure out what an institution needs, it could be what their accreditation what they were dinged on for their accreditation, or just something that that you learn that the hospital or the institution is struggling with, and you're good at it, then that actually gives you the most opportunity to ask for payment. Because if you can save an institution money, they will pay you for that, right? So this is what you put in a dossier, right? So it's a little bit like an academic CV or a dossier. That's what it's called instead of a resume per se. Obviously your educational experience and some of your work experience, any teaching experience, right? So if you have done some volunteer work, I put this on the bottom, teaching at your kid's school actually counts as teaching. But opportunities where you've had people come into your clinic, teaching at the staff, the patients, etc. All of these are teaching experience. So make sure you include those. Any kind of administrative roles that could be on a committee or, the director of whatever it is that you were the director of, mentoring activities, curriculum development and assessment. If you are required to assess your colleagues because you are the, let's say their supervisor, you are doing an assessment of your colleagues. So that counts, put that in there. I mentioned committees, publications, lectures, anything that you've done that can bolster an academic CV, make sure you include those. And the date when it happened. So in terms of administration, I would say build your portfolio by joining a committee, any committee that either interests you or that you think that you have an expertise in. I mentioned learning about your clinic or hospital's greatest challenges. Also learn topics that others don't know, right? Utilization review. These are things that we don't really learn and sometimes aren't really interested in learning, but if you can get a little bit interested in learning it, like utilization review, right? NCQA quality standards, electronic health records, research, managed care, OSHA requirements, HIPAA, FDA regulations, all of these kind of regulatory agencies that have, require a little bit of more in-depth learning that's outside of our area of expertise in medicine. Those are great niches for opportunities in administration. So I think I mentioned for your CV, you're going to highlight your attributes and your skills. So every one of you has communication skills because you use them every day to negotiate with patients, to negotiate with staff, to negotiate with your family. Saying maybe that's just me. I don't know. Anyway, but communication skills, leadership skills. You are inevitably you might be a leader in some aspect of what you do at your site as a clinician. Innovation, any kind of innovation that you've done, whether it's a new quality improvement, to get CME and to get re-certified, we all are involved in some sort of a safety program or, other kind of quality improvement activities. Those are innovations, right? So definitely don't forget to include those. We have any kind of adult education techniques, knowing how to create an inclusive and learning environment. These are all attributes and skills that are buzzwords that are useful for academics and administration. Like if you have a specialty specific knowledge and skills, committee involvement, et cetera, and like I mentioned, quality improvement. So how do you find paying jobs? I would say contact your local or regional institution that offers health education, whether that's your medical school or allied health, but also consider corporations, right? Corporations sometimes want to have programs to teach, CPR, right? Or let's say a corporation or an institution has a childcare, so teaching infant CPR to workers there or to family. So these are ways to kind of get involved and get experience. And then eventually if you've done it for 1 year, then you can actually get paid for it in future years. School districts are sometimes looking for health training, the school nurse or whatever it is. right? Prisons, another opportunity. A friend of mine went and started working at a prison, and my gosh, they paid a lot of money. Probably because it was not quite as sexy as other places to work. So look for opportunities through different departments, right? So the foundational sciences, anatomy, physiology might not have quite as many unless they're doing some sort of clinical application of anatomy, physiology, et cetera. But definitely skills, clinical skills training, in small groups or in precepting. Sometimes they have a transition to internship program or whatever it is where they do procedures or simulation. And they are looking for volunteers to do that. And then after you volunteered for a little bit, you might be able to get that as a paying gig. Online job boards, right? Key buzzwords: administrator, medical director, faculty, lecturer, program director, etc. And then there are sometimes in industry journals like Academic Medicine, at the back of those, they might have job listings. And then sometimes the academic societies for Society for Academic Emergency Medicine is one for medical students, medical school education, medical student education, or medical resident education, more likely, are opportunities within specific fields. And then obviously networking. If you are interested in if you find an opportunity and you can figure out somebody who's a colleague of yours from a conference, or that you went to medical school with, get the scoop from them, right? People are often really interested in talking about their experiences at their sites, etc. And then really try to understand the institution's needs, right? You want to be a desirable candidate. If you know what somebody is looking for, or what that institutional focus is, and you can create a yourself to be part of that focus through your the volunteer work that you've done and your CV, etc., and then your cover letter. All of these will help you get a foot in the door and get hired. Again, some faculty professional development job boards, and then the curriculum is often posted on websites for prospective students, so you can go onto the website also and look at what an institution focuses on. Right. I did that when I was actually applying to medical school and residency programs. I looked at the websites and saw that, I was interested in global health. And so that was a niche that I knew that institution had. So if you are very global and you see a program that has a global health program, maybe you can get involved in that program. So just as another idea. And then obviously, if you can learn about a program's LCME or ACGME accreditation and any problems that they've had, you can be the person to fix those problems. And then obviously you want to get letters of recommendation from anybody who knows you well and might be able to highlight those areas of your expertise. So, in summary, think about what your goal is, right? Where are you right now? What is it that you're looking for? Maybe you don't know. And at the end of the day, even if you try something out, it might not be like, if you volunteer, you can say, hey, this was really fun. I had a great time. I don't know that I'm going to be able to fit this in my schedule anymore. Whatever it is. So, trying to figure out what your goal is will be helpful as you move forward. Know that administration and teaching jobs are out there, but really the highest likelihood of you being able to hire sooner rather than later is to focus on the needs of the institution. And then, like any job, you're going to do research, network, review publications, attend conferences, talk to people. Just get involved, talk to people. Unlike other jobs, though, you might need to start with volunteering. So to just gain experience, get your foot in the door, get known. And then just keep in mind that you already have probably most of, I wrote many, I think you have most of the skills you need. You just need the experience. And don't give up, right? You might be turned down a couple of times, but don't give up. Just keep going. Thank you. Any questions?
Thank you so much, Dr. Spector. You know, so just a few, because you answered almost everything I'd written down, it's already crossed out. Any opportunities that you have experience with or that you're aware of that you can do online, like teaching via Zoom or something like that?
Um, that's interesting. You know, I would say that some of the remediation could potentially be done on Zoom, but it depends what, right? So what's interesting about medicine, obviously, is that it's a very hands-on, right? The physical exam skills have to be hands-on because otherwise you can't examine the ear through the through the computer. Um, I would say that's a really good question. I'd have to look into that. I would imagine yes, but I would say that most of the time when I've done stuff on Zoom, it was by necessity because of, I mean, we recently had fires and we had to transition to an online forum. It's not as much, I don't like it as much personally. So it's something that I suppose that you would be able to do if you are working at an institution. Plus, telehealth is by, you know, so if you are good at telehealth, I'm just kind of thinking here, if you're really good at telehealth, you could probably create a curriculum of how to do telehealth in a most effective way, and that would be an online format.
And I know you mentioned being a mom, congratulations, and homeschooling. Is it fair to say that you are kind of part-time doing this work by choice? And if you wanted to to pull together more gigs and more roles, if that's something you could certainly do?
So now that I'm not, if I were still clinically active, I would be more than full-time. I was always more than full-time.
Yep.
I mean, um, I would say that right now I feel a little bit like I have my hands in a lot of pots, which is great, and I always have. But it is, I would say that right now I am probably more part-time because there are no full-time gigs. That said, I could have applied to be a dean. I just, I was really excited about doing this curriculum development. And I think the dean position is 40 or 50% time. And so if I was doing that as well as something else, that would add up to maybe 70% time, but it's not full-time.
But if I'm correct, you could also double dip and okay, even though I'm like 0.3 FTE, whatever somebody would be, I'm going to go do this nurse practitioner teaching, and I'm going to go do this other teaching.
Oh,
All put
100%.
together a full-time kind of gig through that, or full-time plus actually.
100%. Yeah. There are a lot of there are enough opportunities that are part-time that you can kind of meld together. And there's a lot of stuff that you can do in your own time, which is great, right? I mean, any kind of work that I do, any kind of coaching or anything I do with the students, if it's not at the school, it's done in the evenings because that's when everybody's available. Otherwise, they're working all day, right? So evenings, weekends, or sometimes during the day, I just tell them if they need to come and talk to me during lunch or whatever.
And I love the Yay Me story that you had there. And would you give general advice that a little negotiating might be a good idea when you're working on these roles in terms of what they offer you, and maybe say, well, maybe can I get a little bit more here?
I would love to say that there's room for negotiation. A lot of these roles, I mean, you can always negotiate. First of all, if you have an expertise and they're looking for some teaching, let's say to go that like they can't fill the clinic, 100% you should negotiate for that. Some of these roles are posted and they are standardized. So if this role is 20% of the FTE, could you ask for more? I suppose. Interestingly, this position as a volunteer, this clinical teaching that I'm doing this, because I ended up doing more, like I created a clinical advisor program, and I actually did negotiate to get more, but that's because the job title increased, or the job, sorry, the amount of effort increased. So I convinced them that I was actually doing more than 20% effort or whatever it was. So,
And then
but
this is a little bit off the topic here, but I'm just curious. So What percentage of medical students are you guys able to successfully remediate when they get kind of pushed into you?
Here, I'm gonna stop sharing. What percent? So I would say the biggest cause of medical students not being successful in passing medical school is usually by professionalism issues, believe it or not, rather than academic. But I would say maybe a couple students a year, just sort of, they get remediated and they take a leave of absence. So often they'll take a leave of absence and then decide not to return. So.
And my last question, are you willing to be contacted by your colleagues who might want mentoring or coaching?
Ask me again?
Oh, sure. Would you be willing to be contacted by your colleagues who might want mentoring or coaching in this area?
Sure, absolutely. I actually really enjoyed that part of when I came back and taught last year, the mentoring part of it. It was really, really fun. I felt like I was able to be creative in coming up with some solutions for people who were struggling. So yeah, absolutely.
Thank you very much, Dr. Spector.
You're welcome. Good luck, everybody. I wish you all the best with your future, whatever you decide to do.